Mr. Ali, thank you for coming today to the clinic. And as you know, we're planning today to talk about the chemotherapy treatment for your stomach cancer. But before we start, do you have any question at all?
I do have a question. As you know, we're going through a second wave of the coronavirus. And I've heard and I've read some websites that the risk of death from the coronavirus, in my case, is much higher than the non-cancer patients, particularly as I suffer with high blood pressure and I'm over 70. Just wonder, what do you think about that, and is this true? Early studies suggested that COVID-19 patients with cancer were at a higher risk for severe complications or death than those without cancer, especially individuals with lung and hematological cancers such as leukemia or lymphoma, or who had cancer treatment in the past month of COVID-19 infection. However, larger and more recent studies disputed these findings and found no increased risk of death associated with cancer type or timing of cancer treatment. One study of COVID-19 patients with cancer who were matched 1:4 to individuals without cancer in terms of age, sex, and other health conditions found similar outcome of both groups, including those with recent anticancer therapy. Finally, preliminary results from an international study of thoracic cancer patients with COVID-19 found that smoking history was the only predictor for death. However, the influence of cancer on COVID-19 outcome is difficult to identify because these diseases share many risk factors such as old age, history of smoking, and obesity. Thus, prospective studies with long-term follow-up are needed to better understand the influence of COVID-19 in patients with cancer.
Mr. Sami, thank you for coming today to the clinic. Well, as you know, let's see, you are on Folfox and nivolumab. You have completed 3 cycles and now we're preparing for cycle 4. So how are things going with the 3rd cycle? Any problem at all?
No, not really, apart from the tingling in my fingers, but apart from that I'm okay.
Well, that's great. Actually, the tingling, is it lasting or a couple of days?
Yeah, only a few days, only for the first week of treatment, and it then disappears.
It comes and goes, right?
Yes, yeah.
Right. So actually, this is expected. It can happen with oxaliplatin, as we explained, and your blood looks all well, and you don't have any major issues. So I think we're going to keep on the same dose you are taking, and I will see you in 2 weeks.
Good, good. There's one question, if I may ask. It might not be related directly to the chemotherapy.
Sure.
But I've received an invitation for the COVID vaccine. This is the Pfizer one.
Right.
And I just wonder, what do you think about me having it? Do you recommend it? And if so, when do you think I should take the vaccine? Cancer patients receiving or about to receive systemic anticancer therapy will fall into the clinically extremely vulnerable category, and therefore the overall consensus is that the benefit of the COVID-19 vaccine will potentially outweigh the risks, provided they meet the eligibility criteria for the COVID-19 vaccination. The only specific contraindication to the vaccines are hypersensitivity to any of the active ingredients within the vaccine. The timing of receiving the vaccine relevant to the systemic treatment the patient is on is an important issue. Where possible, treatment should not be deferred or delayed due to the COVID-19 vaccination. There is a small study of influenza vaccine which suggests that administration of the vaccine on the day of chemotherapy reduces effectiveness. It is unknown if the same effect will be seen in patients receiving the COVID-19 vaccination. According to the UK Chemotherapy Board, the vaccine can be given at any time of the cycle except the day of the chemotherapy administration.
Dr. Hassan, can I ask you a question, please?
Please, yeah.
I'm getting a lot of questions about coronavirus these days, and actually,
We all do.
yeah, this I don't know when it will be over.
Yeah.
Well, I have Mr. Kumar with me, who is a 55-year-old, and he's diagnosed with refractory cell lymphoma. And he was admitted yesterday to start a CD19 CAR-T therapy. He's well, he's fit, but in view of the current pandemic, as you know, he is concerned and he's asking some questions.
I bet he's asking about the vaccine and whether he should have it or not.
Exactly.
I do have an answer for you. The current NCCN guidelines for patients who have just had a stem cell transplantation or received CAR-T cell therapy, who are typically receiving immunosuppressive treatment, the recommendation is that they should delay the COVID-19 vaccination until at least 3 months after they have completed the cancer treatment. This is based on data that other vaccines have had limited efficacy during periods when these patients are at their most immune-suppressed stage.
Welcome to the clinic. I hope everything's are well after the third cycle of chemotherapy. Do you have any problems?
No, I'm doing really well from the chemotherapy point of view. No complications whatsoever.
All right, so you look well to me. Your blood tests are fine. I think we can proceed safely for cycle 4.
That's great. I'm happy with this. But I do have a question though. It is not related to the chemotherapy per se directly. I've received the appointment to have the coronavirus vaccine tomorrow. I just want to ask you your opinion, because I've heard that the vaccine manufactured by Johnson & Johnson is the only one suitable for cancer patients because it's single dose only. And I don't know whether you agree with this or not. Currently, a few different vaccines are available and have been shown to be effective at both lowering the risk of getting the COVID-19 infection as well as the risk of getting severe disease in infected patients. The Pfizer-BioNTech and the Moderna vaccines are both mRNA vaccines, while the Johnson & Johnson vaccine is an adenovirus 1. These vaccines have been studied in different places and at different times, but there haven't been any study directly comparing the different vaccines. Because of this, it is not clear if any one of these vaccines is safer or more effective than the others. It is also not yet clear if any of the vaccines will be more or less effective against any of the new variants of the COVID-19 virus. At this time, no major medical organizations have recommended getting one type of COVID-19 vaccine over the other, either for cancer patients or any other individuals. Many health experts believe that getting the vaccine once it becomes available is more important than waiting for a specific vaccine.
We hope you liked our video. This is Acting for Clinical Education.
And don't forget to check the reference down below.
Please like, share and subscribe, and don't forget to join us every Thursday 5 p.m. Greenwich time.